Managing your collection agency. Your collection agency, if you think about it, is simply another employee but in an outside location, and they're an extension of your practice. More importantly, I think we need to emphasize that your collection agency, their emphasis and their processes reflect positively or negatively on your practice. So the collection agency's efforts and philosophies should be compliant with the practice's collection philosophy as well. They do take a different approach than we do in the offices, but you have to be comfortable with what they're doing, not to alienate or create liability situations with your patients. That may include lien placements on assets, typically properties. Do we place liens against property so if the property is sold that the balance is settled? Or do we pursue past due balances in small claims courts? Many collection agencies will do this for you, or some practices have reverted to using certain law firms that do this work for them. Okay. When we talk about best practices, this is where we talk about some of the things that we've seen that we think are best approaches in taking a look at things, how our networks have grown. If you're a hospital system, and you've acquired these physician practices, employed physicians that have been in private practice before, it's very likely you've accumulated an array of multiple practice management systems. How did this happen? When you employed the physicians that were in private practice, they had to keep their own practice management system going to collect their old AR, or many hospital systems allowed the physicians to continue to do